Thank you very much, Anastasia, for the introduction and a real heartfelt start to the conference today. Many of you will be aware that our Minister for Drugs and Alcohol, Ms McKelvey, has taken a leave of absence for medical reasons at the moment, and I know she was really looking forward to speaking to you all today. And I know she would want to express, as Mr Gray has just expressed, her sorrow and sadness in solidarity with all of those remembering a loved one tomorrow on International Overdose Awareness Day. And as Mr Gray said there, it's important to recognise every life lost as a person, a son, a daughter, a husband, a wife, a brother, a sister, a mum or a dad, and our hearts go out to all of those affected. Ms McKelvey and I had a chance to speak about the session today, and she was really keen that I give an overview of where we've got to with the national mission, with thanks to everybody in this room for all of the efforts to get us there, and what our focus is going to be over the next period. As Mr Gray said in his intro there, we're at the midpoint in the mission, so we're turning our thoughts at a national level to thinking about how we really double down and intensify the delivery and build on the really strong foundations in place. So I'm going to take you through a few slides this morning that set some of that out. Here we go. So I'm going to look at 4 key areas this morning. So just run through what the latest NRS statistics and key findings are that were published last week. A bit of a look at progress to date with the national mission, our focus between now and 2026, and then a bit of consideration about what happens next, what about post-2026, and what are we thinking about in that context. So, looking at the national statistics that were published on the 20th of August shows us that, as Anastasia was saying, there were 1,172 drug misuse deaths registered in Scotland, which was an increase of 12%, or 121 deaths, compared to 2022. In 2023, males were twice as likely to have a drug misuse death as females, and most of the increase in deaths was due to male deaths. Since 2000, the average age of drug misuse deaths has increased from 32 to 45. And drug misuse deaths are still much more common than they were in 2000. So after you adjust for age, there are 4.2 times as many drug misuse deaths in 2023 than in 2000. So that tells us the scale of the challenge that we're still facing here in Scotland. In terms of the risks, so looking at what the data is telling us from the latest statistics about the changing drugs landscape in Scotland and the risks that that's now posing to our people, firstly, we know there's an increasing level of polydrug use. So in 81% of all drug misuse deaths in 2023, more than one drug was implicated in that death. We're also seeing an increasing use of cocaine, especially injecting, which was evidenced in the recent Needle Exchange Surveillance Initiative report. And from a harm reduction perspective, being able to adapt to a changing drug market, particularly with an increasing toxicity in supply, is crucial. We know polydrug use can lead to increased risk of harm and overdose. With increased injecting, that also poses risks in terms of wound care, skin infections, and so on. The second point that comes through incredibly strongly from the statistics, and Anastasia made this point very powerfully, is about the link between deprivation, poverty, and drug death. So, as Anastasia said, people in the most deprived areas are 15.3 times as likely to die from drug misuse as those in the least deprived areas. So a powerful reminder that while we approach drug use as a public health issue, it's not purely a medical issue. It comes from deeply rooted social issues and structural inequalities that we must continue to focus on and look at the challenge from a holistic and whole system perspective within government. And then thirdly, the graph there on the right-hand side is just showing what's starting to come through now in terms of emerging data around synthetic drugs in the supply in Scotland, namely nitazines and xylazine. These substances are highly potent and toxic and can elevate the risk of overdose. And they're evolving all the time in their composition and formulation, which makes regulation and enforcement also incredibly difficult. So this WEDINOS graph here just shows, it doesn't give us a complete picture about what's going on, but it does give us some valuable surveillance information, and it's definitely showing that detection of synthetics in the Scottish samples tested by WEDINOS have increased markedly in the last year. So we're seeing a clear, ongoing and increasing presence of new synthetic drugs, most commonly found alongside other drugs, so in combination, heroin, xylazine or bromazolone and nitazines. Okay, so I was going to focus just a little bit on progress to date with the national mission and what we've managed to put in place in what has been an incredibly short period of time, thanks to all of the efforts of everyone in this room today. So the approach that we've taken under the national mission, which was announced in 2021, sits underneath the national outcome frameworks here, which many of you will be familiar with. There are 6 key outcomes and 6 cross-cutting priorities that pull together the range of work that we're taking forward. The approach is ambitious, it's rights-based, it's about care and compassion and putting the needs of people who use drugs at the heart of our service design and delivery. The first phase, so years 1 and 2 of the national mission, was focused on just laying those foundations, bringing local and national partners together, getting services up and running, and putting in place the supporting strategies and policies. And in doing that, we focused on 4 key themes, which are set out there. So harm reduction, improving treatment, workforce and culture, and taking a holistic, person-centred approach to the challenges that people are experiencing. And much of that's captured in the National Drug Death Task Force Changing Lives report. That task force made 20 recommendations and had 139 actions. And the Scottish Government's cross-government plan, which Mr. Gray referred to in his overview, recognises that need for systemic cultural change to truly transform the drug death crisis in Scotland. So the second phase, say years 2 and 3 of the national mission, is where we're at now, and it's about delivering on a clear programme of work. So let me just take you through what that looks like at a national level at the moment. So first theme, just thinking about harm reduction, there's been a huge amount of work done in this area. So just starting with naloxone, for example, Police Scotland became the first force in the UK to comprehensively issue naloxone kits to its officers, who have now administered it over 500 times. Public Health Scotland reported that in 2023, take-home naloxone had been issued to an estimated 705 out of every 1,000 people thought to be engaged in problematic opioid use. Anastasia referred to this as well, but within the limits of reserve legislation, we've managed to push forward with the Safer Drug Consumption Facility in Glasgow, and see colleagues here today speaking about that. We've also progressed work with the Home Office to try and put in place drug checking facilities, and licences are now in for sites in Aberdeen, Dundee and Glasgow. We would hope to be able to expand both of those offers in terms of checking and safer drug consumption to other places across Scotland in due course. And with the Glasgow Enhanced Drug Treatment Service also continues to deliver the heroin assisted treatment programme, and we're keen to see outputs from the Glasgow Caledonian evaluation of that service to look at its applicability in other areas also. Critically, I think there's been a lot of work done on non-fatal overdose pathways. The slides here, we mentioned the fantastic work that the Glasgow team are doing in that regard, and I also just wanted to highlight the excellent work the Scottish Ambulance Service have been doing. There's a brilliant project in Fife demonstrating the real benefits that a multi-service response can bring in providing first responder response with a range of support, so not just naloxone and the provision of injecting equipment, but also BBV referral and support and referral into wider services. So just that sense of local partners really coming together and joining up that pathway is so important. Okay, the second theme I was just going to focus on there was improving treatment. So in the main for us, that's been about focusing on the introduction of the MAT standards, medicated assisted treatment, and the introduction of a complementary treatment target, and also widening access to residential rehabilitation. So there's been a significant increase in the service infrastructure around MAT standards since they were first announced, and the Cabinet Secretary referred to that in his introduction, and that is down to the hard work of so many people assembled here today. In July this year, Public Health Scotland submitted its latest benchmarking report, which showed that for MAT standards 1 to 5 across Scotland, 90% were assessed as fully implemented. And for MAT standards 6 to 10, 91% were assessed as provisional green. Provisional green means that there's evidence of implementation beginning, and I'm going to come back to that later on in the presentation. But alongside that, and importantly, we have experiential feedback now from Public Health Scotland too, and that is showing that there have been fewer and shorter delays in accessing treatment. There's more supported choice for opioid substitution therapy. There's good access to harm reduction at the MAT appointment, and that people felt cared for and supported by their key workers to stay in treatment for as long as they needed. And I know we're going to hear a little bit more today from the SDF about their report on the implementation of MAT in areas of Scotland. Last year, there were 938 publicly funded residential rehabilitation placements. The government has a target to reach 1,000 funded placements by 2026, so we're on track with that. And just a couple of weeks ago, we announced an extra £2 million in an additional placement fund to support residential rehabilitation. And finally, we've been focusing on the workforce, which we know faces serious pressures in this area. We've published a workforce action plan, and we're currently working with colleagues across ADPs and other sectors to develop a competency framework to support the workforce at the moment. But there's still so much to do here, and Anastasia made that point very powerfully in her introduction, and I'll come back to that in the next section. So the final theme that I wanted to outline in terms of progress today is around that whole system approach. So the links between poverty, deprivation, the need to see the whole person and deal with the range of challenges that people present with. So this area of work is really about working across government and delivering priorities which are beyond the scope of my division and the work that we're focused on, but working with colleagues in justice, mental health, housing, in communities, children and families, education and employability, and critically our work to tackle stigma, which is one of the biggest barriers to accessing services that we know from evidence. So in this space, the National Collaborative was established and a draft Charter of Rights was published, and we're launching that charter later on in the year. And that's such a powerful way of embedding lived and lived experience in service design and making sure we're getting qualitative feedback on the service, how it feels, and the impact that it's having on people so that services can improve in response to that. But crucially, it's not just about what we do, but how we do it. So we've said from the start that we want to put the voices of people with lived and living experience at the heart of policy making, and we do believe we're doing that. We've heard that there's no one-size-fits-all approach, but the relational situation is key for people, so that relationship with their key worker is absolutely vital, and we can see that coming through in the SDF evaluation of MAT implementation too. So building respectful, trusting relationships with people who've often been failed multiple times by services is the only way to help them move forward and develop the agency they need to determine the best path for them. So that whole systems approach we're trying to take through the Charter, through our work on stigma, supporting the workforce and thinking about issues like mental health is so important. So just to give a couple of specific examples in this space, we're working with Healthcare Improvement Scotland to develop a mental health and substance use joint working protocol, which is to provide guidance and support to health authorities to work better together to ensure people with co-occurring mental health and substance use conditions receive the help they need. The focus of the protocol is about supporting strong leadership around the planning and integration of services, as well as challenging barriers that are restrictive and stigmatising and drive people away from help. Another good example in this space is we know people often start using substances in childhood, so our work with Public Health Scotland on a national consensus on reducing harm for young people affected by substance use is key, and will provide a whole systems approach to prevention. So to give an example in practice about what that means, we're working with Winning Scotland to deliver the Planet Youth project, which is a fantastic project looking at supporting young people and preventing substance use in the first place. Again, though, there's still an awful lot to do in this space as we move forward with the national mission. So a bit on what now then, between now and 2026. It's clear, and we can see from the NRS statistics, that drug use in Scotland is changing, and there's a lot of complexities about the work we're doing, which means we always need to be flexible and alter our approach where we see that. And it's one of the reasons why, although we're at the midpoint in a national mission, we're already in the middle of an evaluation by Public Health Scotland, because we wanted some real-time feedback on what we were doing and the impact we were having, and some consideration about strategy at a national level. So I'm just going to pull out 5 key areas of focus for us over the next couple of years. I said earlier that MAT Standards benchmarking reports showing really good progress with implementation of Standards 1 to 5, but I think we really need to double down now on the implementation of Standards 6 to 10, especially psychosocial care, which is MAT Standard 6, and mental health, which is MAT Standard 9, both of which underpin much of the treatment provision for non-opioid substance use. We're also developing a national specification for drug and alcohol care and support services. There will be an initial draft out for consultation later this year. The specification is trying to take a kind of end-to-end view of services and outline treatment and recovery services that should be in place across Scotland for all alcohol and drug services. So it's about providing clarity for people on the services, those principles of quality, choice, access, and parity of treatment with other health conditions. I wanted just to pull out here implementation of the Charter of Rights, which will launch later this year, which has just been such fantastic work to have been involved in. My own personal background was I led the social security programme that devolved benefits in Scotland, and I found it so motivating and empowering working in that rights-based way and seeing direct feedback into the services you're providing and using that as a tool to continually improve them, and that must be our ambition here. So implementation of the National Charter to deliver services that are genuinely stigma-free and in a trauma-informed way will become a key focus for us over the next couple of years. And our work to include lived and living experience and service design, delivery and feedback on service quality must be at the heart of that approach. In response to synthetics and what we're seeing come through in terms of the toxicity and supply, Radar and Public Health Scotland continue to expand and enhance their surveillance data, and we're working with Public Health Scotland and ADPs to support local areas to ensure that their incident management arrangements are robust and responsive to any sudden increases in fatal and non-fatal overdoses. And then I think finally, as we've identified at the start, and as Anastasia set out, the challenge around deprivation, poverty and drug death remains, and we must continue those preventative efforts through education, through the structural and social determinants of health, well-being and drug use. We need to listen to people, bring people together more effectively. At a national level, we're committed to working better across government departments. We know that there's still too much silo working going on, that people are passed from service to service. So part of our role at a national level is how we can best encourage that collaboration between the statutory and third sectors and between different public sector disciplines. And there's definitely a role for us to convene much more by way of learning and of sharing best practice around some of that. Okay, I just wanted to end by just touching on what next. I know we're still at the midpoint in the national mission, but we've been turning our thoughts to think about this. The national mission timeframe was the term of this parliamentary session, and the next Scottish parliamentary election has to take place by May 2026. And we continue to take an incredibly ambitious view of what's achievable by that time, and hopefully I've set out some of that today and what our focus will be. The Cabinet Secretary was clear that he has asked us all to really double down and intensify our delivery over the next couple of years. We've got really strong foundations in place. We know now what it is we think we should be doing, and now it's about how we really double down our efforts around doing that. So at a national level, we've been reviewing our framework for delivery. We're going to put in place some additional governance arrangements to really drive accountability and monitor progress and make sure that we're collectively delivering on the strategy we've all signed up to. We're also starting to think a little bit about what the post-2026 landscape looks like in the context of wider reform within health and social care, so thinking about the National Care Service, where do drug and alcohol services fit as part of that, what about regulation, what about inspection, what about funding on an ongoing basis. So we're very clear that by the end of 2026 we need to have a clear plan in place for what happens next. And shaping that future collectively with all of you will be incredibly important. There's such a huge amount of amazing work already happening in this sector, particularly at a grassroots level, and with many of the agencies that are here today. And I think the next 2 years really is about pulling the threads of that together and spreading and sharing good practice and creating the Scotland-wide services rooted in that human rights-based approach that we've talked about this morning, which will be critical if we're going to succeed in the mission. I just wanted to end by saying that I know if the Minister had been able to attend today, she would have wanted to thank you all from the bottom of her heart. She would have wanted to thank you for your leadership, for your hard work, for all the progress that has been made, and she would want to ask you for your ongoing support, for your attention, for your leadership, for really doubling down and delivering in your local area, and helping us understand where national strategy needs to adapt to be more flexible as well. So I just wanted to thank you all for your time this morning, and very much looking forward to the rest of today's speakers and the discussion. Thank you.